Well, good evening, everyone. I'm actually going to do something a little strange, but I want you to bear with me. It's after dinner, you've been sitting for a while, so how about during my opening, I welcome you to stand up and stretch, I won't mind. So feel free. There you go, please, I think you're gonna need it. So please stand up and stretch while I do the opening. So you might be wondering why the CEO of AmCham Singapore is standing up on stage right now. I'm very fortunate because I was trained as an epidemiologist at the Johns Hopkins Bloomberg School of Public Health back in the late 90s. And I couldn't be more thrilled to be back on the Hopkins team today. Thank you so much for the Temasek Foundation and the partners for giving us this opportunity to participate in Philanthropy Asia Summit. Johns Hopkins has been all in during the COVID-19 pandemic. You will find our faculty, our staff, our alumni, our students on the front lines around the world, working with communities, sharing facts, not fake news, facts, via various media channels. And you just will see them developing tools and technologies and testifying before governments, all to support global efforts to fight the COVID-19 pandemic. And now, I would like to show you a video that showcases how Johns Hopkins University and the Bloomberg School of Public Health have been contributing to fighting the pandemic.
When a public health crisis challenges our very way of life, hope is found in real answers. It's found in hard truths and data, under microscopes and across global networks. This is where the world turns for answers, for hope. The Johns Hopkins Bloomberg School of Public Health. Our journey began long before COVID-19. Life-saving answers originated here over a century ago. We introduced the fields of biostatistics and epidemiology. We guided the first clinical trials of penicillin, creating a gold standard for drug development. Our researchers helped defeat polio and are continuing the fight against malaria. If there's a threat to public health, our faculty and students are working to understand it and reduce its risks. Today, answers are sought at 80 research facilities across 67 countries. Together, we are addressing some of the biggest, most pressing threats to public health. By leading and translating public health to the world, we make policy and healthcare systems work better and inspire future researchers, practitioners, and policymakers.
I don't think there's any more important job than saving and improving lives.
We take what we learn and put those answers into practice. Research becomes tangible. We develop strategies and solutions the world can use and trust. And in ways big and small, we change the course of history. It's hope and determination, powered by science, because this is where humanity finds answers. Johns Hopkins Bloomberg School of Public Health. Protecting health, saving lives, millions at a time.
And with your support, we can do more to empower and protect our most vulnerable. And now I would like to introduce Dr. Jennifer Nuzzo, faculty at the Johns Hopkins Bloomberg School of Public Health, who will share our response to the call to action for pandemic security. Jennifer?
Thank you so much. It's really good to be with you all. As we've unfortunately seen, the health, economic, and social tolls of COVID-19 have been staggering. And yet, not all of us have suffered equally. Vulnerable populations, from refugees to the disabled to migrant workers, have all been disproportionately affected by COVID-19. But On the ground, in communities across the world, innovations have been developed with limited resources that have helped to protect and to serve these vulnerable populations. We know that community members came together to support one another. They created systems, they utilized the solutions and the tools that they had, and they innovated. They created new approaches to help try to protect everyone. We have to learn from these communities. We have to learn from them, study them, understand how they did it and what works. And we should be able to create hubs that others can learn so that we can benefit from the knowledge that this, very unfortunate situation, unfortunately, helped to generate. We'd like to scale up these innovations so that they're not just helping small communities and small numbers, but that they can be applied elsewhere as applicable. And most importantly, we need to have a global conversation about how we can manage pandemics going forward with an understanding that the most vulnerable among us will always be disproportionately affected, that our societal vulnerabilities to a pandemic are reflected in those of us who, the need for all of us to be able to protect ourselves. So to discuss more about how we plan to do this, it's my great pleasure to introduce Dr. David Peters, who's the chair of the Department of International Health at the Johns Hopkins Bloomberg School of Public Health. David?
Thank you, Jennifer. And hi, everybody. It's morning here in Baltimore, Maryland. I'd like to begin by first acknowledging that Baltimore and Johns Hopkins University are built on the traditional and unceded lands of the Piscataway and Susquehannock peoples. Let me first introduce other members of our panel, and I believe the slide should be up for you now. Piya from the Thai National Health Foundation in Bangkok. Stefan from the Bill and Melinda Gates Foundation, who's joining us from India. Rawlance from Makerere University in Uganda. And of course, you've already met Jennifer also from Johns Hopkins. I'd also like to acknowledge another one of our partners, Sing Health Duke NUS Global Health Institute, which is based in Singapore and is one of our partners that's focusing on technological innovations in the program. So let's look a little bit more closely at why it's so important to have an equitable response in pandemics and why protecting vulnerable populations is critical to global recovery. Jennifer, can you explain further?
Sure, thank you, David. I mean, what we've seen and continue to see, and have to acknowledge the fact that we're continuing to see this as the pandemic is still very much unfolding around us, but it's incredibly clear that vulnerable populations have been some of the most affected by COVID-19. We see vulnerable groups disproportionately represented in our cases, disproportionately represented in our hospitalizations, and unfortunately disproportionately represented among our deaths. And it's probably also related to the fact that these groups have largely been left out of the ongoing global response to COVID-19. This is clearly an ethical failure of global proportions, but it's also a pragmatic failure. Continued transmission of this virus raises possibilities of mutation. That will put everyone at risk, particularly if the mutations render our vaccines and therapeutics not as effective. So really, it's in our best interest to make sure we control the spread of this virus as much as possible. And to do that, we cannot leave behind the communities who have been most affected. Public health interventions, so there's a clear need to do this in terms of being able to limit the ongoing transmission. We also need to do this in order to be able to implement the measures that we know are effective at limiting transmission. And public health interventions, we have learned and continue to see, require trust. And in order to get that trust, we need to engage with communities, all communities, but particularly those who are at greatest risk and perhaps have been on the margins. So it is incredibly important that we learn how to engage with communities for both ethical and our pragmatic best interests. We shouldn't continue this pandemic or head into the next one without a strong sense of how to engage with communities in order to protect the most vulnerable among us. What happens so far is that communities have sort of spontaneously developed solutions to protect themselves, and that's really great. But we need to learn from those spontaneous efforts. We need to figure out how to connect that learning with other communities that are still trying to figure it out, and we need to figure out how to scale this. So this is what I think the urgent call is right now for this ongoing pandemic, but crucially to ready our protection for the next one.
Thanks, Jennifer. It's really good to hear. It's not just about charity ethics, but it's really in our collective self-interest for so many reasons you described. Let's take a look at some of those successful community innovations. And I just want to explain to the audience that when we're talking about innovation, it's not just about technological innovation. Many of them are social or systems innovations. So I'd like to turn to Piya. Can you tell us a little bit more about some of the community innovations that you've seen in Thailand?
Thank you, David. And like in other countries, pandemic has had serious impact on our communities. And at the same time, it allows us to see a number of innovations that help us help each other in time of crisis. And this can range from very simple to like a paper template that allows me to support local food stall, to give a free meal to people who are in need, or a system that we at the National Health Foundation has a chance to be partnered with. It is called Co-Care. Co-Care was initiated by Dr. Kongkiat, and he and a few of his friends started this community-led effort to basically address healthcare access problems among the most marginalized populations. And their network started off with less than 10 volunteers. These volunteers wanted to do more to save lives, and they initially provide teleconsultation to COVID patients and their families in Metro Bangkok. These patients are the ones who had to stay at home because they don't have access to medical care at the time when our supply is very in serious constraint. And the group later expand both in terms of their reach and their scope. At one point, they have more than 400 volunteers, and they provide support to more than 4,500 patients. And they both expand in terms of their scope to cover community COVID testing, because they believe that just waiting for people to get infected is not enough. They also provide medicine delivery for those who don't have proper care. And these are in marginalized communities in Klong Tei, informal settlements, in dorms of migrant workers who don't have health insurance. And I would say the example of Co-Care is an example of voluntary-based system that has been developed in order to support people who are deeply in need in time of crisis. And this can be a good example with a proper system to support or to allow us to learn from each other. It can be expand and probably have more impact in a broader sense. So thank you, David.
Thank you, Piya. That's a great story of an effort that starts with a few and turns to many. That's great. Let's turn to you, Rawlance. Can you tell us about some of what you've seen in Uganda?
Thank you, David. So one of the groups that was hugely impacted by the pandemic here in Uganda were young people living with HIV. And this is really because they had challenges in accessing drugs at the health facilities that they used to do. So a group of young people living with HIV wondered what was happening. So they reached out to their peers to really find out how they were coping. In this process, they actually were able to realize that many of the young people were not able to reach out to the respective health facilities. They're not able to get their routine medical care, also getting their essential drug refills. So this was really compounded by the fact that transport was a challenge. There was a lockdown, so they couldn't move. The other thing about young people is most of them prefer not to get drugs from nearby facilities because of stigma and discrimination. So they had to go miles and miles to get some of these drugs. But also there are other challenges that you could actually obtain a travel permit to go to the facility, but you need to disclose why you're going to the facility, and that created more challenges for the young people. So coming together as peers, young people, this group was able to actually go to the facilities and check who is it that has been able to access their drugs and who is not able to do so. So by going through this process, they are able to make arrangements to ensure that those who are left within the community who are not able to access their drugs actually have peers deliver these drugs to them who come from the same communities. And through this process, we realized that many of the peers were able to actually continue with this important lifelong treatment. But that wasn't it all, because even as the young people reached out to deliver drugs, they found that sometimes the other young people are struggling to get something to eat. And this is really usually an issue that affects adherence to HIV treatment, especially among people. So they still try to mobilize, reach out to some organizations and obtain some resources and food and ensure that they deliver drugs, and they're also able to deliver some food to keep the young people going during this pandemic. This really shows us some of what can be done in the community if groups come together, if people within the community come together to actually support each other during such pandemics. And I really feel it has potential to be scaled up. Over to you, David.
Thanks, Rawlance. That's a great example of many stakeholders, and particularly youth and peers coming together to create innovations that start small and again go to scale and take on one problem and then go to the next. A really good example with potential well beyond this pandemic. I want to just also highlight another issue here in the United States. Here, we've really learned a lot from our Indigenous communities. At the beginning of the COVID pandemic, they were some of the most badly affected. They had some of the highest infection rates and they had the highest death rates of any ethnic group. Now, these inequities are rooted in generations of trauma and ongoing structural racism shown through broken treaties and policies that were meant to erase their language and culture. Many American Indians currently live in conditions of poverty, often in multi-generational homes, and have high rates of non-communicable diseases. This makes them particularly susceptible to COVID. But during this pandemic, we saw this great transformation. Many tribal communities came together to draw upon their community values and culture and identified innovative and trusted ways to share information about how to protect communities from COVID. This could be through storytelling and books in their own languages, and setting up ways to distribute medicines and food, returning to traditional home gardening to address food shortages. So what happened was they leveraged their own strengths, but also built on decades of collaborative research and practice with academia, including Johns Hopkins Bloomberg School of Public Health and our Center for American Indian Health, and then with additional support from philanthropy and business, as well as government. They were part of the first COVID vaccine trials, and then implemented their own vaccine distribution plans. So American Indians now have the highest vaccination rates of any ethnic group in the United States, including Caucasian Americans. So you can see how that transformation works at scale. Now, we hope that with support of people at this summit, we can learn from and leverage these kinds of experiences so that we can ensure that everyone is protected when the next public health disaster strikes. So Jennifer, I'm going to turn to you and ask if you can explain more about how this can happen.
Yeah, thank you for that. And thanks to everyone for those really inspiring examples of the power that results when communities come together to protect those most vulnerable among us. What we're proposing to do is to develop a global community pandemic innovation lab that serves as a network hub where communities can come together and discuss and learn from their pandemic responses, what they did, what worked, what didn't, the lessons that they accumulated along the way. The goals of the hub will be to connect communities with each other and with governments, universities, philanthropies, and businesses that can engage in this work directly with them and support them. And with the goal of increasing that learning among the whole network, but also attempting to try to scale this. So we'll also create a global challenge that provides fundings to networks of innovators, the communities that are doing this work, and governments that wish to engage in them, with the goal of trying to scale these things up, taking these small, really good ideas into larger and larger areas. We will also be convening hubs of global community leaders to continue to learn and support each other and to adapt the innovative but context-specific practices that they've been engaging with to apply into other places. We think that translational work is really important. And so that convening of these leaders, I think, is a really essential component of this. But the goal here is to take all of this learning, build it, sustain it, support it, adapt it, so that we can have an impact on this pandemic, but crucially prepare ourselves for the next public health disaster.
Thanks, Jennifer. That's a great summary of the proposal of the plan. Stefan, let's turn to you. From your perspective as working at a major foundation that looks at innovations really around the world and in many areas, and you've already committed enormously to addressing the COVID pandemic. Can you speak to this gap that this project can fill?
Yeah, thanks very much. I think there's a strong case for building better ecosystems. The world's not lacking in innovators, but it's often lacking an ecosystem that can help connect innovators, foster continual learning and improvement, and promote scale of the best approaches. Two examples that I'd like to cite quickly that I think we've learned quite a bit from. One is the Rockefeller and Gates Foundation supported something called the Center for Health Market Innovations, which tracked over 1,300 private sector health innovators in low and middle income countries over more than a decade. One key finding was that very few of these went to scale, maybe 10 or 20 out of the 1,300 surveyed. One reason was the lack of a supportive ecosystem, making it very hard for innovators to connect, share information, or spread best practices. More recently, during the COVID pandemic, there's been tremendous variation in country and community responses, and the better responses did not always come from the richest countries. And yet no real mechanisms for sharing or adopting better practices and approaches in real time exists. This again speaks to a missing supportive ecosystem. The Bill and Melinda Gates Foundation has recognized these structural gaps, and I'll offer a couple of examples of COVID-related support to date. As background, the foundation has provided over $1 billion to address COVID over the last 20 months. A few bespoke examples related specifically to Singapore. We partnered with the Asian Philanthropy Circle, the N Foundation, Lee Foundation, and others to contribute to Gavi COVAX, and partnered with the Asia Venture Philanthropy Network, Makerere Bank Foundation, and others to set up the Southeast Asia COVID-19 Response Fund. In addition, leveraging our experience with setting up the Africa Pathogen Genomic Institute, we're in discussions with NUS to partner and explore setting up a similar hub in Singapore to build regional community around sequencing, genomic epidemiology, and disease surveillance to enhance public health in the region. If you'd like to know a little bit more about these or other foundation efforts in Singapore, please contact our partners. This would include May Lowe at the Albright Stonebridge Group, Gavin Smith and Jeremy Lim, both at NUS. We see this effort by Johns Hopkins as another positive and creative step forward in terms of fostering a supportive ecosystem to address the new normal of the world after COVID. Thanks very much.
Thanks, Stefan. It's really important to hear about that ecosystem and for learning and scaling and the examples you've provided. Jennifer, can you tell us now what impact you think that we should have or hope to have with this project?
Yeah, so in developing supporting networks of communities that are working together with governments and business, universities, philanthropy, et cetera, we aim first to build on the plans and the experiences that have starting to accumulate during this pandemic with the goal of improving and reducing vulnerabilities for the next pandemic. We have seen in this pandemic, and I will tell you this lesson will continue to repeat itself if we don't do something, our societal vulnerabilities are our pandemic vulnerabilities. So the best way to reduce our societal vulnerabilities is our pandemic vulnerabilities is to reduce our societal vulnerabilities. We aim to do that by building these networks so that we can learn how best to protect vulnerable communities. We believe very strongly that this work in building these networks and trying to protect and serve vulnerable communities will not only build trust between communities and the other entities that they engage with. We aim to empower local and national leaders who are prepared to protect their communities and to share the learnings that they have accumulated with others. And again, as you said before, David, I have to emphasize, this is not charity. This is pandemic pragmatism. Taking care of the most vulnerable among us is not only the morally right thing to do, but it is also the pragmatic one. This is how we reduce our vulnerabilities to the pandemic. This is how we build resilience in our communities. This is how we protect ourselves going forward. And we have the stories of what communities have done have been one of the few bright spots in all of this. So we want to build on that and make sure that we have even more tools in our toolbox to be able to respond by learning what we've done so far.
Thanks, Jennifer. This is really exciting. At this point, I'd like to turn over for some questions in the audience. And Hsien, are there any in the audience there?
Yes, well, there are people in the audience, if that's what you're asking me, but we'd also take questions from the audience since we're all in the same room together. There are a couple of questions in Pigeonhole, so I'll go ahead and ask one of them. It's about the applicability of insights may be limited by local context and local capacity. How can recommendations be tailored for a best fit?
That's a great question. And maybe I'll ask Piya if he's got some ideas on how that works. He described an example with lots of adaptations and changing.
Thank you. It's a very good question. And I think it's very important that we recognize what you were asking about the local context and local capacity. But still, there's potential to learn. And all of this, we're talking about the system approach to the problem, the system approach to the solution. And many of these examples can potentially shed light for you to basically look into the potential, what we call the influencing factors, and also all of those, how do you deal with it as an example of best practices that can be used. So definitely need to be adjusted, applied, and take into account what is going on in your local context. Yeah.
Thanks. I'm just wondering, maybe Rawlance, do you want to comment on that as well?
Yes, I could add a similar perspective that has been shared by Piya, but really to say that we need to learn the lessons. What are the barriers? What are the facilitators? What makes this work within the context? And then from that, say how we build it. And the trick word that I remember Jennifer said is how do we then adapt within a new context? How can we work with the communities to say that what we are bringing on board is something that is generated with the support and thoughts of the community, but also work with all the stakeholders through multi-sectoral collaboration. I think I'll trip it to that.
Thanks. Hsien, do you want to go to the next question? Or?
Yes, why don't we close out the session with a final comment from you, David, and any of the other panelists about the kind of support that we're seeking from the partners today in how we can execute on our proposal.
Thanks, Hsien. That's a great question. You know, we're looking to have partners in this endeavor. We need partners to link communities with government, but also with philanthropy and business and with academia, because the examples we've seen have been cases where they start in one place, but it's when they start connecting to other stakeholders that things really come together. That's how we create the ecosystem that Stefan talked about. And so we are hoping, for example, that people in the room, that you join us to be part of this effort. It will help with the communications, the networking, the influence, because this is really about how do you learn from great ideas and experiences in small places, and how do you pull them together to influence things in one place, then how do you learn and continue that across regions and really around the world? That's a big part of what this is to address a pandemic from a community perspective. You know, in public health, it means about putting public back into public health, and it means starting. We all learn about where it is that we're supposed to start from, and it is really with people. So we're hoping that with goodwill and minds and efforts of all kinds, we're going to be able to put together a lab where we're able to leverage our strengths, pull together the great ideas, and then focus like a razor on marginalized communities, because that's where the most of the action is. We're going to be working to build that trust, and we do that by working together. And with that, at the end, we hope that we will have really an educated and trusted set of partners that will really be focused on helping us all by helping the most vulnerable populations now and going forward. You have this learning capability that takes us forward. So I really want to thank everybody, the Temasek and everyone who joined us at the at the summit, and looking forward to where we can go in the future. If you have any further questions, please do contact us, and we look forward to addressing them and to discussing further. Because at the end of the day, we really need to work together in order to protect our most vulnerable populations, and through that, protect everyone. Thank you very much.
Thanks so much, everyone. Cheers to the global community.